People are in deep pain with this condition, looking for answers, trying many different things, and ultimately coming up short with the kinds of programs that are available in the diet world. We are one of the few that really focuses on behavioral change from an empirically based system of intervention. Most of the programs that are out there are very light on the psychology part. They just don't deal with the brain and with the psychology of individuals who have developed these habits for very real reasons in their life. And we're going to help them to figure out what those reasons are and change the way that they behave and the way that they use food in their life to solve problems.
When people are struggling with co-occurring disorders, we develop treatment plans specially designed to attend to these other symptoms that the patient's struggling with.
The most important thing that I can do on that initial evaluation is rule out any other psychiatric illness that might be contributing to the symptoms of binge eating. And that could be an underlying mood disorder, anxiety disorder, attention deficit hyperactivity disorder, or even substance abuse disorder. So there are many other disorders that can exist with binge eating or actually contribute to some of the symptoms.
The Walden model is really to provide a rational road to recovery for any eating disorders. We have all the levels of care: hospital, residential, partial hospital, intensive outpatient, and outpatient services. Individuals with binge eating disorder often can be treated in outpatient or intensive outpatient levels of care.
So I think what's really wonderful about the treatment for binge eating disorder at Walden is that we've had a dedicated program for binge eating disorder for a decade. And over time, we have shaped that program to be more effective and to meet the needs of our patients. And so at this point, we are integrating pieces of all the most evidence-based treatments for binge eating in our programming.
Binge eating, by its nature, is isolating. In fact, it's one of the hallmarks of the diagnosis is that the binge occurs in secret. It's a very secretive disorder. Bringing it out into the light is a very important aspect of the treatment.
One of the beauties of treatment at Walden is we do most of our treatment in group settings, and I think that the experience that the individuals that we work with, the experience they have of being able to share their experiences and hear about the experiences of others, it's so important to the process of recovery.
We have kind of individual therapy programs where we can develop a medication plan as well as a therapy plan that fits an individual's kind of life so they can continue at work. And then we have more intensive evening programs, so intensive outpatient programs 2 or 3 nights a week where someone's going to be able to get group therapy, more intensive work.
In 4 weeks, you will be in much better condition. You will likely be in a situation where you have very much reduced the number of binges that occur in your life. You will be at a point where you have begun to develop new skills around how to deal with your life. Your nutrition will be much improved, your eating will be normalized, and you will well be on your way to recovery in 4 to 6 weeks.
I think the most important thing that I can share with a patient with binge eating disorder that enters our clinics is that binge eating disorder is treatable. We have lots of tools, we have medications that can be helpful, we have very clear psychotherapy programs that can be helpful, and then nutritional consultation. So I call it 3 legs of a stool. If we can kind of put those 3 components together and individualize the treatment, binge eating disorder is completely treatable and symptoms can really disappear.
One of my favorite things about working with the people who come through our program here at Walden is when you experience so much growth and change, and you've learned so much about yourself, about your eating disorder, but also about yourself. People are living lives that they've always wanted to live. They're saying things out loud that they've always wanted to say out loud, and they are experiencing more of the emotions that they've always wanted to experience. And that's an incredibly rewarding process to be a part of as a clinician.